Hello, everyone, and thank you for joining us for Inspire You. I'm Tina Cosby with the Indianapolis stations of Radio 1 and host of Community Connection. We are going to be talking about open enrollment. Open enrollment for health insurances is now underway with the deadline not too terribly far away. So that's why we're going to be talking about it. That's why we're talking about it right now. Here now to help us understand and navigate through some of that, actually through most of it and a lot of it are Marcus King. Marcus is the operations manager of patient access services at Eskenazi Health. Alexa Ray, also manager of operations for patient access services at Eskenazi Health. And Nicole Harper, the chief financial officer at Eskenazi Health. So before we get started, those titles are interesting, so we want to give everybody an opportunity to know a little bit more about each of you, what your titles are and what you do. So let's start with, we'll go ahead and start with you, Nicole Harper. How are you?
I'm great, Tina. Thank you for asking. Mm-hmm. I get the opportunity to serve as the chief financial officer here at Eskenazi Health, and my role really is to support Marcus, Alexa, and our teams to ensure that our patients have excellent experiences and the support to continue to receive care here at Eskenazi. So I have a really fun and exciting role in the efforts to help make sure the community gets what it needs.
Indeed. Alexa.
Absolutely. I'm the operations manager. So I have 5 primary care clinics where I'm responsible for the registration and financial counseling team members at those clinics. And I've been with Eskenazi for a little over 4 years. And I love, like Nicole said, the opportunity to serve our most vulnerable patient population here in Indianapolis.
Glad to have you with us. And Marcus King.
Hello, my name is Marcus King. I'm currently an operations manager for patient access and primary care. I support the registration and financial counseling functions of 3 of our outlying clinics here at Eskenazi Health, and I've been with the organization for 10 years.
So Marcus, in a way, is it safe to say that you and Alexa are more like the bridges between the services and the clients, the services and the patients?
Yeah, so we help support the supervisors at those locations. So we have operations supervisors that, assist the team members, but we help the supervisors meet the needs of the patient population at those specific clinics. Help, map out a lot of the workflows and things and goals and things that are established for patient access in our organization.
Yeah. Well, when a lot of people hear open enrollment, and I hear this on my talk show a lot, just those 2 words, it gets overwhelming for a lot of people who don't understand. There's some that really need clarification between Medicare and Medicaid, let alone all of the other things in between, the marketplace, the terms that people have to navigate, embrace, and work through to get everything done before the deadline. Where do we start, and how can we start with a basic understanding of what it is we're talking about?
Well, there's no better time than during open enrollment to start understanding how some of those things work. But basically, open enrollment is a time period that every individual has to enroll into a health coverage plan throughout the marketplace. It is a lot, but we've done a good job of making sure that we have financial counselors available throughout the city of Indianapolis to help navigate some of those questions. So, it's overwhelming. There's a lot of information involved, but that's what we're here for. We're here to kind of answer most of those questions, kind of relieve some of the anxiety around digging into open enrollment and see what it has to offer each individual.
So what's the first thing individuals should do when the window opens for open enrollment? What's the first thing that a person should do?
If we're speaking of the marketplace, if you have questions, we need to link up with one of our financial counselors.
Let's start with the marketplace. I'm sorry. Let's start with the marketplace. You're right.
Okay. So with the marketplace, the first thing is to submit an application. You can do that at healthcare.gov. And what that's going to do is it's going to, provide you with some baseline information to go from. There's a lot of things around the marketplace. It's too expensive. It doesn't do this. It doesn't do that.
Mhm.
Submitting an application does nothing but see what your options are and what's available to each individual. So I would encourage individuals to register an account, start an account, submit an application. That's going to consist of you entering some personal information about yourself, about your household, about your financial information, and just see what the marketplace has to offer. I think once most people start digging in to that process, they find out that there are some affordable options out there for health coverage.
Yeah. COVID-19, some people's healthcare coverages have changed as a result of the COVID-19 emergency and changes in deadline and things of that nature. Can someone explain what people need to know about that?
So with the lifting of the public health emergency, FSSA is trying to get back to pre-COVID kind of the ways that they did things. So people are going through redetermination periods right now, which means that the rules are a lot more strict. They're not as laxed. So some of the documentation that was required during the pandemic, they weren't making people provide. So now they are, and they're finding that some people, whether it's that they're over income, maybe their address changed and they didn't know they were going through the redetermination period. So people are losing coverage. And for those who don't qualify anymore because of their income or whatever the case may be, Marketplace is going to be an awesome option for them. And there are tons of different plans to help meet the patient's need based on, what type of services they're looking for and who's in network. So that's kind of the gist of the public health emergency coming to an end. It has just left some people feeling like, well, I lost my Medicaid. What do I do now?
Yeah. So what about Medicaid and Medicare enrollment periods?
So I don't think any of the Medicare enrollment periods have changed because of the public health emergency. Those remain the same. When it comes to a Medicaid, or when we look at it from a perspective of Medicaid, there is no open enrollment for Medicaid. So if you qualify, you can apply at any time for that program.
Mm-hmm. For people to understand the difference between Medicaid and Medicare, can you explain that?
Yeah, so Medicaid is, and our Healthy Indiana plan falls under the Medicaid umbrella per se, but Medicaid is a state-funded program that you need to meet specific financial and household information guidelines to qualify for. Your Medicare program is federally funded, and it is, centered around our individuals that are 65 or older or are disabled population that's been disabled for, I believe, more than 2 years.
Yeah. So, and circling back to, the lifting of the public health emergency, are there any other changes that people need to know about this year for this open enrollment in terms of the marketplace?
The big one is that the deadline is extended to January the 15th. Prior to the public health emergency, the deadline was December 15th. You would need to make a payment into your plan for coverage to start January 1st. And that's still true. However, they've extended it an additional 30 days for individuals until January the 15th for coverage to start February 1st. So I think they've done a good job of kind of extending those deadlines. So instead of the normal November 1st to December 15th, we're looking at almost 2.5 months of open enrollment. Some of the other things that they've done is for our Medicaid population that fall under the HIP or the Medicaid umbrella, so our HIP population, Hoosier Health Wide, if you lose coverage or if you've lost coverage, since April of this year, there's actually an open enrollment period that can get you into that coverage until July of 2024. So I think they've done a really good job of offering the marketplace as an option for anybody who has lost Medicaid or a Medicaid product within the last year.
Yeah. So Nicole, as a chief financial officer, I'm going to ask you a financial question. The cost of healthcare, even in the marketplace and think, how would you characterize it? How would you frame it? And what is that for folks to know about? What is there for people to know more about there?
It's it's a $1 billion industry, right? I mean, the cost is continuing to increase for various reasons, and the need is continuing to increase. So I think one of the questions that you asked when we first started was, how do you get started? And I really feel like this is the best way. I'm a huge patient advocate, and that's one of my passion areas. And one of the things that this team is really great at is connecting with patients and making sure they have the resource and the information they need to make the best decisions financially for their families. Mm-hmm. And I really think that when you think about the cost and when you're talking about the cost, step one is to figure out how you're going to approach next steps. There should never be a time where a patient doesn't seek the care that they need because they're concerned about the cost. Not here at Eskenazi Health. We have a team of over 400 people that are dedicated to nothing but supporting patients' journeys from a financial perspective to make sure that they have the support that they need to get the care that they need. And I think that's a big part. And so that first step, Marcus's team, Alexa's team, they exist to make sure that our patients have everything they need, the information to understand what options they have, the support to understand once they do receive services, how do you navigate through handling any remaining balances on your bill to get ready for the next visit that you may have to have. It really is a matter of, in my opinion, making sure that you have the knowledge and the access to the information so that you know exactly what you need to do to move forward and what help you may need. We have all types of help and processes that our patients can access. And the best way to learn that is to connect with one of our professionals here at Eskenazi to make sure that patients have that information. So I really, from a cost perspective, think that that's the best way to navigate through it. The costs are varying. There's all sorts of versions of what costs may impact patients, whether it's a preventative service, whether it's an elective service. There's so many different scenarios. The best advice that I have for our patients is to make sure you connect with our counselors. You connect with our experts so that they can help you navigate through what next steps may look like. And there's so many resources. I think one of the big challenges that we have is patients don't understand where all the resources are and how to tap into them. Right. And that's why it's so important to take advantage of these open enrollment timeframes. We have multiple events where we're out in the community connecting with patients, trying to ensure that they're getting the resources and the connections that they need, and take advantage of that, because that's going to be the best first step to ensure that patients are comfortable navigating through. And it's very challenging and it can be overwhelming. And that's why I like to say that's why you need your person. You need your person that can help make sure you know what questions to ask, and any question is okay.
Yeah. So when you're out in the community and you're connecting with people one-on-one, what's the most common concern that you hear that, when people are approaching or thinking about, how am I going to get covered for health insurance, or how can I do this, or how can I do? What's the most common thing you hear? Is it finances?
I think it'll probably change depending on who answers this question. So I'll start first. Okay. So my biggest feedback from patients is I can't afford it. Okay. I can't afford it. And I knew that I wasn't going to be able to afford it, so I just didn't come. And when I hear that, it absolutely breaks my heart, because there's no reason why that should be the truth, because there's too many ways for us here at Eskenazi to help patients address and support whatever they need to get the care that they need. But from my perspective, that's what I hear most often is I just knew I couldn't afford it, so I just didn't go.
Yeah. Alexa,
and Marcus and Alexa, may have.
You have a different perspective or different experience?
Yeah, so I'd say along the same lines, but if we're talking marketplace specifically, I feel that it's just difficult to navigate. It's easy once you understand and once you know more, but when you're in the marketplace, you can compare different plans. There's different levels of plans. So there's bronze, silver, gold, knowing if your providers are in network with whichever type of plan you want to choose. So I think that it can be overwhelming and difficult to people who haven't navigated any type of healthcare system before. Maybe they had employer-based things before and they had HR who could help walk them through it. So I think knowing that Eskenazi has an amazing team of financial counselors who can walk patients through the entire process, whether it's Medicaid or whether it's Marketplace, we walk patients through, help them understand, and help them with what documents they'll need to provide and things like that, because it's not over once you submit the application. In some cases, there's verifications that might be required of you and deadlines that you have to meet. So at Eskenazi, when you meet with our financial counselors, we do everything from the front to the back until we get that final, hopefully, approval. So I think that that's kind of the benefit of coming to see one of our financial counselors, and we have them at almost all of our locations, if not all of our locations, every primary care location, the main campus hospital. Our Sandra Eskenazi mental health centers have financial counselors. So we have a very robust team who have been trained to help you understand the process and walk you through from the beginning to the end.
Absolutely. And Marcus, your experiences.
Yeah, I would agree with both of those. My answer was going to be closing the circle. Right. So, I mentioned earlier, starting the process, getting an application started, but how do I close the circle?
Yeah.
So that includes being informed about what these different plans offer.
Yeah. Has the navigation of the Marketplace been simplified in any ways? I mean, in any significant ways over the years, or does it remain confusing? And I guess in a lot of ways difficult for consumers to navigate.
Well, I think that part of the problem is that, when I think of myself, I come from a place where, I speak English, things are on the screen that I can read. So we don't think about some of the barriers that some of our patients face, like language barriers, reading barriers and things like that. So, when I look at it, it may seem like it's easy to navigate for me because I have a background using technology and things like that. But for someone, depending on age, depending on education and background, and if they trust government and things like that, there are barriers that I don't face, that I have to think, oh my gosh, this might be super overwhelming for someone who doesn't speak the language or who doesn't understand, or who might not be able to read at the level or understand. I can read, but I don't. That doesn't mean that I understand everything when I'm signing up for coverage. So to be able to have someone walk you through it or help you with those barriers is just incredible. And it can really help patients feel more at ease, especially once they understand that, providing documents and things like that, it's just to determine if you qualify. It's not for any other purpose. So there are lots of nuances to healthcare and to healthcare here in the United States. And we're just here to try and help our patients, help alleviate that financial burden, because it's a lot when you just are trying to seek care.
In terms of seeking care, one of the frustrations that I hear from people is the fact that there is an AI wall, meaning a virtual assistant that will tell you to do this or tell you to do that, but then your particular concern isn't exactly on the menu of the virtual assistant or the artificial intelligence mechanism, whatever that may be. Is there any of that involved in this process that is being shared here for our consumers?
I'm sure there is. I'm sure there are some of those options that, can become confusing. We have streamlined really the process of getting patients over to meet with the financial counselor. We've offered in-person and telephone appointments. So, I do think those barriers exist, but there's also other options of coming in and just making an appointment. And you can make an appointment just to ask questions. If that's what your preference is. We don't necessarily have to apply for anything. If you just want to meet with a financial counselor to explain different terminology related to healthcare, we can do that as well.
So what is it that again, I guess we'll circle back, that people need to know to get coverage for 2024? The basics.
I think the biggest thing is going to be understanding deadlines.
Okay.
So if you want your coverage to begin at the beginning of January 2024, then you need to apply before or by December 15th. And if you can apply up until January 15th, but your coverage won't start until you've made that payment, and it'll begin on the first of the following month.
Now, those deadlines, you say the one deadline has been extended, right? For the marketplace?
So it's kind of twofold. Mm-hmm. So it goes until January 15th. So that was the extension for the first one. However, if you want your coverage to begin January 1st, you have to apply by December 15th. And then the deadline that was extended for those who have lost Medicaid coverage due to redeterminations, that is going to be July 2024.
So where are these deadlines posted? Where can people get to these deadlines and find out more about everything that they need to know?
So I know Eskenazi, we've got it on our My Chart. If people use their virtual options, we've got it posted kind of all over throughout the buildings in our financial counseling centers. I know that they've done some advertisements, most likely on social medias. But also, I saw a commercial this weekend for Marketplace Open Enrollment, and it listed all those deadlines. So I do think the community is doing a great job of trying to get people to be aware of those deadlines. Like I believe like Walmart has signs when you walk in that say, about open enrollment. And I'm not sure if the date's on there, but I think everyone's trying to do a good job of getting the word out. And Eskenazi, specifically on this Saturday, we're hosting a health insurance fair to kind of try and get the word out and help our patients come navigate, whether it's Medicaid or Marketplace Open Enrollment. We are trying to make every effort to be out in the community as well as at all of our health centers.
Yeah. And so what do people tend to do? Behavior, I guess I'll go back to you, Ms. Harper. What is the behavior? Typically folks wait till the last minute, or are people proactive, or, what do you think folks do most of the time?
Yes, is the answer. We see a little bit of everything. I mean, we have some people who are very proactive, some of which because our process here at Eskenazi is to follow up with our patients who are Medicaid, who are already enrolled in Medicaid. If they did experience some disenrollment as a result of the redeterminations, then we're reaching out. We're trying to make sure that they have everything they need. Every time a patient comes in, we're reviewing what they have, what they're enrolled for, and just as a matter of a process in our organization. And if we see gaps and opportunities to help, we can partner with patients from that perspective. And we see people who are afraid to ask questions, so they don't ask anything. And we end up helping them real time in whatever current state they're in as they come to receive services. So we see it all. We see proactive, we see reactive, we see a little bit of, we see no action at all sometimes. I mean, we see a little bit of everything here. So Marcus made a really good point, though, in terms of we're here to answer questions. Some of this is just a fear of, Alexa made a great point, too, in terms of you get online, you can't understand all the details. And even if I can read and speak English, still some of that wording is so difficult to understand and process through. And even if I can get through the bottom of that screen, I still don't really know what I'm clicking on all the time, or I don't really understand if I click this, then that means I'm going to get X, Y, or Z. And so having that opportunity just to come and ask questions is really helpful. So we have appointments available and open. Alexa mentioned our event this December 2nd here at the main campus, 720 Eskenazi Avenue. We'll be here from, I believe it's 10 to 2, just to be available to answer those questions and really help direct and determine what we need to do next, or, what we can do to help, what the patients can do next. So I think from that perspective, because it's just so varied what we see because our patient population is so varied.
Yeah.
It really helps to start with, what questions do you have? What can we do to help?
You all have brought wonderful news in the sense that there is help. There are a number of resources, and there are humans that to talk to that are going to be available at your disposal. And I think that is that's just invaluable. So to remind people who are watching, how can they access this help, the deadlines again, and what they need to do. So I'll let whoever wants to give that reminder. But we want to put it out. Okay, go ahead.
Yeah. So the deadlines are going to be, if you'd like your coverage to begin January 1st, you need to apply for open enrollment by December 15th. The deadline for open enrollment is January 15th, 2024. If you have lost your coverage due to a Medicaid redetermination, then you have an extended open enrollment. It's an extended special enrollment period, and that's through July of 2024. If you're interested in any of our financial counseling services here at Eskenazi, they are free, and you can call 1-855-202-1053 to schedule an appointment, or you can come into any of our primary care health centers, the main campus hospital, and we can get you scheduled for an appointment. And if traveling is an issue, we do telephone appointments. We have DocuSign that we can utilize. So there are options if traveling is a barrier as well.
That's amazing. And anything else that before we sign off here, anything else that you want to make sure we get out there as well?
We're just really looking forward to the chance to connect with the community. We're looking forward to supporting our patients. So please come visit, and we'll see you all soon.
And Marcus, go ahead.
Yeah, don't hesitate to reach out. We're here for the community. Our mission is to advocate, care, teach, and serve. Absolutely. That's what we're here for. We're not looking for anything specific when you come in other than to answer your questions, to advocate, to care, to teach, and to serve anybody who comes through our doors. So if you have questions, if you want help from the beginning to the end of the process, get scheduled. We're here to help.
Absolutely. And we'll have that information on our website. And the general website, what is it? EskenaziHealth.edu?
No, that's it.
That's it?
Nope.
Okay. Nope, that's it.
Yeah, and I believe there's a link to financial counseling once you get there.
A link to financial counseling.
Once you get in there, yes.
So, but don't be afraid that you don't be concerned that you can't afford it. Help is available, but please pay attention to deadlines. And if you're getting information in the mail, open it up. If you're getting, now, are phone calls made sometimes? Would you say, yes, open the mail. And then sometimes follow-up phone calls are made as well?
Yes.
Yep.
Absolutely.
So if you've utilized our services, then we'll be following up with you. We'll let you know if there's any documentation that we need. We'll let you know when you're approved.
All righty. Well, thank you all again so much. Like I said, that's good news. I'm smiling. That's good. It's good to know that it's out there and that a lot of folks are going to get a lot of help and a lot of coverage, a lot of much needed healthcare coverage. Thank you all for all you do. We really appreciate it.
Everyday life is busy enough without worrying about viruses. But just because you're ignoring flu and COVID doesn't mean they'll ignore you. Right now, Eskenazi Health Center is protecting everyone from 6-month-olds to seniors with safe, updated vaccines that can help keep your family from missing school, missing work, or missing good times. Visit eskenazihealth.edu/vaccines and see how a shot in the arm can take a load off your mind.